Hi, my name is Ashish Panchal. I am an emergency physician at The Ohio State University. I'm an EMS boarded physician, and I wear a couple of different hats in the work I do. I'm on the Medical Advisory Board for ImageTrend, as well as being the Research and Fellowship Director for the National Registry. Some of the most pressing challenges when we think about pre-hospital care these days that we have to depend on research on right now is really understanding the story of what we're all facing. So care changes, care evolves, and one of the biggest challenges we have is what do we need to do to improve that care? The struggle we have is implementation. We have so many good ideas of how to intervene for a STEMI or a stroke, but how do we take that and operationalize that on a daily basis is one of the fundamental things that we struggle with as EMS clinicians. One of the things that I regularly do is collaborate with the ImageTrend team when it comes to research and data. And one of the big reasons behind this is that data gives us an idea of what's actually happening. It tells the story of EMS. And so many times when we think about the story of EMS, we think about the anecdotes. This happened in this case, or this happened in this case. It doesn't really help us understand how we treat large populations. The ImageTrend data set allows us to have a vision into a nice, large, representative population of EMS clinical care so that we can actually start making real implementation plans that can affect every single person in every home in the United States. Imagine if we could help that person who lives in rural South Dakota as well as that individual who lives in urban Columbus, Ohio. One of the big topics we talk a lot about right now is what can we do to help people who have a traumatic injury? And the number one topic that comes up is the use of whole blood. Can we take what we've learned on the battlefield and apply it in our clinical civilian populations to improve care? Now, this is a tough question. It's not something that we can just do overnight, and we need large databases and we need data to really describe how this is most effective for our patients. And it's not a small thing. We're looking at people donating, let's be honest, their life's blood to improve the outcomes of other people. And that is a gift that we have to be respectful of, and we need to make sure it gets to the right people so we can save the most amount of lives. The only way we can do that is literally leveraging large databases so we can understand exactly what's happening and save the most amount of lives. I'm all about clinical guidelines. Most of my work has been developing American Heart Association guidelines or evidence-based guidelines for pre-hospital care. One of the biggest challenges we have is a lack of good data. Even when we talk about airway management that we've been doing for years and years and years, we have a hard time really saying that this is the exact right approach. And a lot of that has to do with data quality. And more, the exciting part of this is our EMS clinicians are starting to do a great job of giving us good documentation and good data management. And the reason for that is they're being supported appropriately by our EMR systems. If you have a system that's designed around the EMS clinician and the job they do, you will get good data. And ImageTrend allows you to do that through the platform that we have available so that we can not only enter good data, but then look back and see, are we actually making a system that works for them, and then change it so that we can actually continue to improve. It's one of the best parts, that customization, which really moves care forward. What really excites me when we think about how time is changing when it comes to research and using data and talking about evidence-based guidelines is that today, what's happening is every single concept and every single moment of care that happens in the United States goes into our larger data sets, and we're able to leverage that to help mom, to help grandma, so that we can put new strategies, new protocols in place so that we can save the most amount of lives. We're in an era that the implementation of these data insights can change the paradigm and save a life almost every single day. And so much of this falls on our EMS clinicians. They're doing the hard work of actually doing the work to save the life What we need to do as researchers and as corporations and as really advocates for care is we need to put the pieces in place so they can do their job to the most and so that we can save more of those lives. One of the big intimidating things that I hear a lot about is, I can't do research. It's so hard. It makes no sense to me. I don't like numbers. And truthfully, one of the fundamental things that I tell people, all research is telling a story. It's telling a story about something you really care about EMS. So does that story start with continuous process improvement? So, hey, this is what we've done for our acute coronary syndrome patients. This is how we got them to their cath lab, and this is how they have great outcomes. That's research. And there's just pieces in there that we can put together and we can work together to move forward. So when you think about research, don't be scared about what might be there. It's another opportunity to improve care throughout our community. And when all is said and done, that's why we're here. We're here to help our communities, and this is just another way to tell that story. One of the fundamental challenges that we have right now throughout the United States is we have a challenge in our workforce. We have EMS clinicians who are suffering because of the work they do. Now, we've seen this a lot of different ways. We've seen it in mental health, and sadly, the place we've seen it most is suicide. It's our friends, it's our family. These are our family people. And one of the biggest changes that we're seeing throughout the work that we do as researchers are people paying more attention to the workforce and what's going on. And through our collaborations with ImageTrend, we're able to start looking at what's happening in the licensure workforce. What's happening to our EMTs and paramedics? How are they getting into our system? Why are they staying? Why are they leaving? And then we also can start talking about what's happening to our colleagues when they're on the job. What's causing them to leave? Is it the job is just too much? Is it the stress? Is it the pay? All these questions are out there, and we need good answers. And this is what research is all about. Again, telling the story of EMS. And this is the story we have to tell so that we can save our own lives and save our own industry so that we can be out there to help the next day.